I'm Catherine Dong. I'm the Director of the Inner City Health and Wellness Program at the Royal Alexandra Hospital. So my career started here at the Royal Alexandra Hospital as an emergency physician, and in my practice in the emergency department I began to see more and more patients that were presenting to our hospital with substance use related concerns, and I did exactly what I was trained to do as an emergency physician, which is treat their acute issue and discharge patients and see the next patient. That's what I was trained to do, and I got frustrated over time with not being able to deal with a lot of the underlying issues that were resulting in that emergency department presentation. Do you ever use stuff like heroin, morphine, Dilaudid, hydromorphcontin? So the ARCH program is the Addiction Recovery and Community Health Team, and this is a specialized consult service at the Royal Alexandra Hospital that sees patients that are admitted to hospital or in our emergency department that have active substance use issues or are dealing with lots of social issues as well. Say, for example, you got sick with pneumonia and you were homeless and you were drinking alcohol every day. We can offer you just so many more services than we could before. So you receive not only expert management for your pneumonia, but expert management for your very severe substance use disorder. We could offer you now a managed alcohol program to make sure that you stay and engage in care and complete your antibiotics for your pneumonia. We can also provide access to an immunization should you require it, as well as support either in hospital or out of hospital around accessing income support, housing, identification in partnership with the ID program here now at the Alex. So we really offer a bigger basket of service and more expert in addiction management than we were able to before. Walking through the doors of this hospital does not erase what has gone before. So we need to offer a full range of full spectrum of services to our patients that have evidence behind them. There's a huge amount of evidence behind harm reduction, but traditionally it has not been implemented in acute care settings. So prior to ARCH starting, we were in this very paradoxical place where we had a hospital full of clean supplies and clean needles, but patients who were reusing, sharing needles, and generally using drugs in a very unsafe manner on site, despite the evidence around harm reduction in the health and medical literature.
I'm Rob Gurney, peer support worker for the Addictions Recovery and Community Health Program at the Royal Alexandra Hospital. My role with the ARCH program is being a peer support worker and having my own experience with addictions for 25 years, including alcohol, cigarettes, marijuana, injecting cocaine and smoking crack, and being homeless for 10 years. So I'm able to relate to the patients that come into the program. Most of my role is emotional support. I also help them get their identification. I help them with the harm reduction and harm reduction education. Meeting the patients and talking with them and hearing their stories and just knowing that they're being heard and they're not being pushed into a corner and forgotten, I think is huge. I know for myself, when I was a patient here at the hospital, I didn't have that, and I wish I had that, because that really makes a difference, and the feedback we get quite a bit is someone's listening.
My name is Elaine Heshka. I'm the Scientific Director of the Inner City Health and Wellness Program at the Royal Alexandra Hospital. The ARCH team really is doing cutting-edge care for the inner city population in Edmonton, and some of the things they're doing are rare in Canada and rare in North America. And there isn't a lot of scientific evidence documenting the practices they're doing in an acute care setting, because it is so innovative. And so a big focus of our team is to rigorously evaluate ARCH and what they're doing. It's also important to hear directly from patients, and so we do a lot of research where we're talking specifically with patients to hear their stories, and their stories are really critical for two reasons. One, they provide a much broader understanding and context on what is it like to be someone who's struggling with drugs or alcohol and ending up in the hospital, and two, the stories are key for essentially winning hearts and minds. Like, how can we improve care, and why is that important, and what is the impact when you take that extra time to care for a patient that is struggling with their drug use, or to acknowledge their need for additional supports.
I'm incredibly grateful for the incredible support that this program has received. We would not have been able to do this innovation and treat patients in the way that we do now without this level of support. So I am be forever grateful, really, for being able to get this program off the ground and really offer the best care that we can to our patients that need it the most.
I think the Royal Alex really needs to be congratulated for the leadership they're showing at a national and international stage in terms of improving care for patients with substance use disorders.
The value of the donor support is It's incredible. It's actually heartwarming, and my own biases where people generally don't care about us inner city people. We're just people on the outside and we don't matter. And they'll brush us aside. They'll walk past us when we're on the street. They will walk away from us if we're drunk or intoxicated. And being there myself in the past, I've felt that. I know how that feels like. I still feel that. I still get that now and then. People will walk across the street and they'll avoid me. They'll grab their purses, hold it tighter. They'll hold their kids behind them. And it's a judgment call. They don't know me. And it hurts. And to be able to have people who I don't even know, people the patients don't even know, to be there and give money, give their time, their hearts, is beyond words. This foundation has literally saved lives. There have been patients and people that have fallen through the cracks through the system. And to be able to have a team, a medical team, a social team, an addictions team, and myself be able to work with these patients, work with people that I was one of these patients, as one of these people, it literally has saved lives. I can't say enough about that. So thank you for doing that and saving lives.